Save the Children has been supporting us for about 2 years for RAMCA program. So today basically is to look at the data and where there's a gap to tell us what are the bottlenecks, what are the challenges that you are facing, and what can we do together.
We have facilities that are performing and we have facilities that are underperforming. So using this forum, it could be important for us to just understand from the best performing facilities, what are they doing differently, so that the other facilities can adopt them for implementation.
In terms of the population estimates for Makadara sub-county, it has 279,073 with 55,000 households manned by our CHPs. Maternal death, we had 1 in 2024, 2 in 2025, and 0 in 2026. For the year 2025, for Makadara we had 5 neonatal deaths. For Bahati we had 1 in the year 2024 and 3 in the year 2025.
So in Kamukunji, we only have 5 public facilities compared to Makadara, who have 12. We have estimated deliveries at 12,166. It's the same as the live births. So in terms of our maternal deaths, we had 14 in 2024, we had 4 in 2025, and 3 so far in 2026. So for our ANC indicators, I can take, for example, Isili Health Center. They had 1,167 as new, and of that, only 321 were mothers less than 12 weeks attending their first ANC.
CFK trained 100 CHPs from Makadara sub-county. So those CHPs have been working in the various households in the community, and we have been doing quarterly data review on NC, postnatal, under 1, under 5, and nutrition. Then early this year, we did a refresher training for those 100 CHPs on maternal and child health.
So for us, we have CHPs trained, 200. Then we do our data review meetings quarterly. Then we do scorecard review meetings where we meet with the facilities to know if the recommendation that the community gave, if they have been taken into consideration.
Moving to the next summary around service delivery for the last 3 months. For pregnancies, around 177. New pregnancies identified, just 10. Then current deliveries that have been probably supported by CHPs, uko kwa community, we have 135. Then in terms of ANC referrals, we do have a total of 49.
We know what is working because we've been having the review meetings for the last 2 years. But now let's think outside the box also. What is it that we can do differently to be able to improve our indicators?
So what is working for MNCI in our facilities in Kamkunji? Early health seeking behavior, and also prompt referrals from the community. So this calls us to capacity build our community health workers on ICCM.
With us at the Makadara, we have a trained sub-county HMT at the health facility and community EPDSR committees, and they are fully functional. Second, there is quarterly data review for maternal and perinatal deaths. That includes near misses and zero reporting.
When it comes to skill deliveries, what is working? We have drills, CMEs, capacity building of healthcare workers on FANC. Then we also have MOC mentors trained together with the facility healthcare workers.
High number of immigrants not registered on SHA. That one will solve it in reaches and outreaches that don't require SHA registration, which is a challenge, I think, to most of our facilities because of the SHA.
Makadara sub-county work plan. One is infrastructural upgrade for theatre and NBU unit in Makadara Hospital and Bahati Hospital. Another long-term is operationalization of a maternity wing in Lungalunga and Kaloleni.
We look at our work plan for Kamukunji. We say there's late initiation of ANC care. The change idea is we need to sensitize our mothers. They need to understand if they are expectant, the mothers need to start ANC as early as possible. Before tutrainiwe, hali ilikuwa mbaya sana. Wamama wengi walikuwa wanakufia kwa nyumba, wakizaa kwa nyumba, tunapoteza watoto. Lakini wakati tuliletewa training, tukafundishwa na tukafundisha wamama, tuliweza kutoka mahali pale. Saa hii hakika wanajifungulia kwa facility.
So kwanza nilikuwa na complication mob sana juu nilianza clinic akiwa for almost 4.5 months after kuzaa mtoto. Nilikaa almost 1 month 3 weeks. But huyu vile nilikuwa na mimba, nilishughulikiwa na CHP wangu, alikuwa ni monitor. Nikaenda kwa clinic 8 times. Sikuwa na complication, delivery ilikuwa sawa na nikaenda nyumbani vizuri, sikuwa na shida yoyote.
On my side, nimeona mabadiliko. Nimefunzwa mambo na fenye tunafaa kufeed mimi na mtoto, mambo ya usafi, and then afya yangu tumefunzwa mambo ya family planning also. So nimebenefit.
Wewe kama CHP, ni changamoto gani ama challenges gani yenye unapata ukifanya kazi yako?
Ni hitches. Unaenda pale inahang noko kwa nyumba. The moment tunaenda hapo na black book. Hii kindelay unaandika hapo. Ukienda kwa nyumba utaenda kumalizia hapo. Hiyo challenge sasa imetuondokea kidogo. Sasa haitupei shida sana.
Ni hiyo tu, tunaitisha tu more training tuweze kujua hizo severe diseases za watoto na mambo ya malaria. Pia inaua watoto sana, tuweze kutrainiwa tujue vile tunaweza kujua malaria.
So the main objective for this specific project review meeting was to closely sit together with the different stakeholders that we've been implementing the project with, targeting the county leadership, the sub-county health management teams, working with the different facility in charges and also community health promoters to just assess performance for the project, trying to see in terms of the different indicators how are the two sub-counties performing.
Prioritization of maternal newborn services has not been so well within Nairobi County. So we're looking at what are the things that are happening that we can be able to advocate for increased allocation for maternal newborn and child services.
When we started this project, we visited several facilities and we realized there were several challenges in those facilities. One of the big challenges was accuracy and incompleteness of data. We didn't have a safeguarding and child protection policy, but when Save the Children came in, they helped CFK as an organization to develop child protection and safeguarding policy.
We are trying to reduce the maternal mortality by training healthcare providers on management of expectant mothers, and also our CHPs are helping in identifying these expectant mothers and referring them to the health facilities for ANC so that they are given the IFAS and prevent the neural defects. Then in the child health, we have CHPs in the community who help in identifying the sick children and refer them to the health facilities.
The performance has been positive for the last 2 years or so, especially involvement of CHPs in terms of visiting the household and also integrating the service delivery into the health system. The other innovation is also the digital health system, where we have all the information in one setup, and that means we're able to create a dashboard where now we monitor the progress and monitor the deliveries and monitor the outcome of the patients.
We also managed to train healthcare on MBDSR, that now we are able to have our staff audit any maternal death to make better outcome for the mother and the newborn.
It has really improved how we respond and how our communities are able to be helped at the facility level.
We really appreciate the partnership, and for the gains we have gained, we promise to sustain.
Save the children!